Larry D here. Wanted to do another video now. It's going to be my second one. Day 6 after my surgery, where I had my kidney, ureter, and the portion of the bladder cuff where the ureter goes into the bladder removed. They stitched the bladder shut and the whole bit. But before I go on, I want to say something real quick about somebody. There's a individual I worked with as a reporter at one of the newspapers. She was always a wonderful young woman back then, and I look at her pictures now and she hasn't aged. I haven't figured that one out. But anyways, she has a son, and he had to have his kidney removed, and he's a young guy. I had heart surgery when I was 6 years old. I always joked that was back in the days when they had stone tools and voodoo doctors around you. Being in the hospital as a child is a challenge for the kid and for the parents. Probably more for the parents, because children are so resilient. And I just want to say this before I go anywhere else. Connor, you're the man. I want my own Kevin the kidney. Okay? I've been following everything that went on with you. Your mom was posting stuff. I've talked to her. You're a strong young man. You should be very proud of yourself. And funny thing is, this old ancient person sitting here looks back at you and says, hey, that kid gives me strength. So I want to thank you. Okay? But do me the favor, keep giving your mom a hard time in a happy way. I always see the pictures of you, the two of you smiling. Love it. So Christy, thank you. And Connor, you're the man, I'm telling you. So let me get on with what I wanted to talk about. On May 30th, I had the kidney ureter combo taken out. It was done robotically. I have 7 small incisions around my abdomen, one larger one next to my navel running vertically. Apparently that larger one is where they actually took out the specimen, or whatever you want to call it. And they were also able to have better access to my bladder to get that portion cut off the cuff. And that's what they call it, where the ureter enters the bladder. Good thing is, this doesn't affect me in any way. I mean, other than I'm down a kidney now. I have one other good kidney. I had cancer in the ureter, not the kidney. So I didn't have kidney disease. So that's a good situation. And the gold standard is to remove the kidney, ureter, and the little bit that attaches to the bladder. So I'm good there. I wanted to talk about how it felt to come home. I only spent one night in the hospital, could not sleep worth a darn. And I'm sure it was probably the pain medications and that were keeping me up. And the biggest thing was, at that point, pain. The pain in my abs was just horrendous. Trying to move around sometimes, man, it was a chore. But it resolves. They gave me a box, or we have our bolo drugs here, and pain medications in it, and some other stuff. The second thing that was the biggest problem was sleeping. Trying to lie down, when you're lying down, when you start to lean back, you're using your abs. The abs hurt. It is not a comfortable situation. So the solution I came up with was, I have a wedge pillow that you can use, that it keeps it at an angle like about that. It's for if you suffer from acid reflux. And I had a bout of it years ago. I got the pillow, it helped me then. I kind of put it away, don't need it any longer. But I got the pillow out, put it on the bed, and that kept me at the little bit of an angle that I was not putting a stress on my ab muscles as much. That really, really helped. I was able to sleep after that. Taking the narcotic pain medication to try to go to sleep doesn't work for me. I get agitated. I don't know if other people do that. I get restless. And for 3 nights in a row, I did not sleep until I remembered, man, the wedge pillow. I have another medication for sleeping that helps me get to sleep. I don't use it that often because it can be addictive. If I use it twice a month, that's a lot. But I decided to give that a try instead of the opioid pain medication. So I was taking my regular stuff. I took the one to get me to sleep and had my wedge pillow, and it worked perfectly. After 3 nights of sleeping a couple hours each night, to be able to sleep 7 hours straight, it was fantastic. So think about that if you come home. How are you going to sleep comfortably? Because you need to sleep to heal. And that wedge pillow worked for me. I know I've read and seen a few people talk about you sleeping in a recliner. I don't have a recliner available to me in the living room, so I did a couple nights just doze off sitting up on the sofa. But you need to get sleep, so think about the wedge pillow, think about a recliner. Something to take that stress off your abdomen when you're lying in the bed, that you're not stretching those muscles out. Third thing I want to bring up is you come home with a catheter, most likely. I have a Foley in that goes up into my bladder. It's, you have a small bag that you can hook to your leg. You have a larger bag that you use overnight. I have a kidney that is like trying to show off, so he's pumping a lot of fluid. And the large bag overnight is definitely needed. The problem I did have, and that was Thursday night, was getting blood clots coming loose from inside the bladder. Remnants from when they did the surgery. And they blocked the drain tube out of my bladder. I was sitting on the sofa, noticed that the bag hadn't filled up much yet, and I was getting really intense feeling of I had to urinate. I got up, walked around, went in the bathroom, stood and relaxed. In essence, convincing my body it was going to urinate like normal, was able to push the clot past. And it literally filled up the 1 liter leg bag almost instantly. That's how much urine I had in me. I drained it, it filled back up partway. It did it again 2 more times that night. And those 2 other times I was able to get them freed up by getting up and walking around. And as uncomfortable as it may seem, you need to get up and walk around. Moving around like that is going to help you in a lot of different ways. Because just sitting on the couch, sitting on a bed, you're not going to heal as you should. I get up and walk around a lot. I can't really just sit still. So the walking around helped. I did contact Henry Ford Hospital Urology. They have a 24/7 urology resident you can speak with, which was very helpful. He told me not to worry about damaging myself. That's what I was concerned about. When I build up so much pressure in my bladder, I would damage it. And he said, no, that wouldn't happen. But he also heard how I was speaking, and at that night I had taken an Oxycontin to try to get some rest, and I was starting to get a little, goofy, high. And he said, you need to sleep. Just go to sleep. You'll be okay. And he was right. But after that, after those remnants from the day of surgery got out of there, because it was not fresh stuff, I had nothing but clear urine. No tinges of blood, nothing. And I actually sent my doctor and told him he's an artist with suturing that cuff up. I mean, my gosh, 4 days and I'm nothing. That's amazing. Now, the other thing I wanted to bring up real quick, and then I'm going to get to the drugs and some ideas there. Bowel movements, going to the potty. When you are put under anesthesia, you're put to sleep. And in essence, the actions of your intestines also, as they would say, put it to sleep. You need to be able to go to the bathroom. You need to be able to have a bowel movement. They gave me a stool softener laxative combo, which I normally would not take. I took. Take them. If they give them to you, take them. When you reach a point where you say, man, I don't need this, I'm not having a problem, then you can stop. But it's better to do that than 4 days, 5 days go by and you say, I can't have a bowel movement. I feel like I'm going to explode. And start taking them then. So Take them as directed and until you don't need them or until your doctor says you can stop. Anything on this, you check with your physician. When it comes to the drugs, like I said, I've got the bowl of drugs here. What my wife did, and this is super helpful, two things. First, we have a list of all the times that I took a med. Not that I'm ancient and won't remember, but when you're taking 4 different pills that are all white pills, your brain will get a little screwed up, especially when one of those is a stronger painkiller. So you might say, did I take the muscle relaxant at 10? Or was it the Tylenol at 10? Well, this way, I look at my list, I know exactly what I took last. She also took the bottles, and of course your discharge papers lists all your medications and says what they are. She wrote on the label, in this case, instead of me looking at methylcarbamol, I look at that and I say, oh yes, it's a muscle relaxant. So I know exactly which one to take, what time to take it. So just having them labeled like that really helped a lot. But I got to tell you, day 6, I'm feeling tremendously better. My abs still hurt. It's just life. It's going to get better. And, on occasion, they will, it'll get a little worse and then it calms down. The only medication I'm taking for pain are 2 325 milligram Tylenol tablets and the muscle relaxant. You're taking that every 6 hours, each of them. Not extra strength Tylenol. You want to keep your dosages of Tylenol under a limit. And I'll put that on the screen, what's recommended, because you can damage your liver. NSAIDs like Advil, which is ibuprofen, any of those are not recommended because they cause certain changes to take place in your kidney while they are active. So stick with Tylenol is what my surgeon told me. So 6 days. Today I got up. I'm making bread. I got some rising in the back right now. I got to yank it out of there and turn the oven on and get it to bake. The pain is greatly reduced. The Tylenol and the muscle relaxants really work. I will never again say, oh, Tylenol's not that good. It is doing wonders for me. The stool softener laxative they gave me, it worked because when you sit down to have a bowel movement, what do? You push. And what do you use? Your stomach muscles. So you don't want to have any of that pressure on there. They say don't pick anything up over 15 pounds for like a couple weeks minimum. And I moved something today that I probably should not have, and I could feel the muscles tugging on my side above where I used to have a kidney. So I'm not going to be picking anything up that's over 15 pounds for a little bit, just to be safe. They said I could get back to full normal activities in 6 weeks. So I'm planning a couple backpacking trips, and I'm going to get the heck on the trail as soon as I can. But, again, I'm amazed. Robotic surgery, like I say, 7 small incisions around my abdomen, 1 in the center. I look like a robot's gone crazy on me. And 6 days, and I'm up walking around doing stuff, making bread. I'm feeling so much better. It's amazing. So if you have this kind of surgery in there, hang in there. But the biggest thing that you need, and I don't want this missed, the biggest thing you need is a physician who is responsive to you. The physician I have, the surgeon I have, this man is phenomenal. Number one, he has a sense of humor like mine, which is kind of sarcastic, which is hysterical because we start joking. But if I call him, he calls me back. If I have a question, I call the urology department. They call me back right away. I cannot stress enough how important it is to have a good surgeon, oncologist dealing with a problem like this, because this is the most serious thing that any of us ever have to deal with. If you get a doctor who you feel is kind of putting you off, or you feel put off by him, it might be an idea to look for somebody else. So make sure you have somebody that's good, well respected, and cares about you. So that's my rant on that one. But again, hey, 6 days, man, I feel good. A couple more days, I don't know. I'm going to be losing my mind because I can't drive for 2 weeks. So that was the other thing. Until the muscles heal up some, you don't want to be driving because you don't want to slam on the brakes. Have a steering wheel impact your abdomen, or have the seat belts squeeze the living heck out of you. And 2 weeks. So I have 1 week to go before I can get in my car and go and just go out for the day. So that's about it. I can't think of anything else. If you have questions, feel free to ask, please. I will answer any question like that. Again, mine was cancer of the ureter, and the gold standard is to remove the kidney, the ureter, and where it goes into the bladder, the ureter portion. So that way all of the tissue that could possibly have been affected is gone. And that's fine with me. I hope this is helpful to somebody out there. So do me a favor. I have another week before I can get in my car and drive. So I'm kind of stuck at home or in the area walking. So head outdoors and have some fun and do something for me, will you? And whatever you do, be safe. Thanks.